Let's move on to those drugs that act on the sympathetic nervous system. Specifically, we're just going to focus on alpha blockers right now. So these alpha agonists are often very good drugs. We have the alpha-1 agonist like phenylephrine, and alpha-2 agonists like alpha-methyl-dopa and clonidine. Now, phenylephrine is an alpha-1 agonist, and that will actually cause constriction of the blood vessel, and it causes high blood pressure. So we put it there just to remind you that alpha-1 and alpha-2 have very different effects. Obviously, we don't use phenylephrine to treat hypertension because it causes high blood pressure. Let's go on to the alpha-2 agonists. So alpha-methyl-dopa and clonidine. Let's compare and contrast alpha-methyl-dopa and clonidine. The alpha-methyl-dopa, or I'm going to call it Aldomet for simplicity's sake, decreases central sympathetic outflow. Similarly, clonidine does the same thing. Aldomet is a prodrug. It is metabolized to the active agent. Both will decrease central sympathetic outflow, cardiac output, and vascular resistance. Both have a compensatory reaction of salt retention. They both do this. There are some idiosyncratic reactions which distinguish the two drugs. The idiosyncratic reaction of note with Aldomet is hemolytic anemia. The idiosyncratic reaction of clonidine is rebound hypertension. Both, of course, cause sedation because they're working centrally. In terms of use, Aldomet was previously used extensively in pregnant patients. In fact, Aldomet is the second most common antihypertensive drug used in pregnant women, whereas clonidine is definitively categorically not used in pregnancy. So these two drugs are very, very different in one very important respect, is that Aldomet is used in pregnancy, clonidine is never used in pregnancy.